It's said that a new strain of influenza virus could cause a global pandemic. Like a horror movie come to life, such a novel virus would spread rapidly because most individuals would have no immunity against it. What sort of things can we do in the way of everyday prevention as countermeasures in the event of a major epidemic? Today, with the help of an expert, we'll explain what you can do to protect yourself and your loved ones from novel influenza viruses.
So, Doctor, let's jump right in. What exactly is novel influenza?
Well, it refers to the emergence of a new type of influenza virus that quickly spreads from person to person due to the fact that we have no immunity against it. We have yet to see an outbreak of such a novel influenza, but if an outbreak occurs, it could result in a global pandemic. For that reason, we're now working on ways to respond, assuming that there will be a major epidemic of novel influenza sometime in the near future.
That's a frightening prospect. So, Doctor, what do you recommend that we do to protect ourselves?
Broadly speaking, there are three important things you can do to help protect yourself from new influenza viruses. 1. Understand how viral infections work. 2. Learn the correct preventive measures. And 3. Take appropriate action if you become infected. As long as you grasp these 3 points and put them properly into practice, there's nothing to be afraid of. Another point to remember is that influenza viruses remain active longer in low-temperature, low-humidity environments. So you must be especially careful during winter, when the air is dry. The first thing to do to protect yourself from novel influenza is to understand how infection works. Both novel and seasonal influenza viruses enter the body through droplet transmission. That is, droplets containing the virus are sprayed out, usually when someone coughs or sneezes, and another person breathes in those droplets through their mouth or nose. Viruses inhaled through the mouth or nose reproduce inside the body, causing the infected person to show signs of influenza. When that happens, the body reacts strongly to the virus, so you experience symptoms all over, such as high fever, joint pain, and muscle pain, to name just a few.
In other words, if you don't breathe in the virus, you won't become infected, right? But if someone coughs or sneezes right in front of you, it doesn't seem like there's much you can do about it.
That's right. Please take a look at this. Here we've used special effects to show just how far droplets from sneezes disperse. As you can see, droplets from a sneeze travel more than 2 meters. Large droplets containing a lot of water fall to the ground, but small droplets still remain in the air, but very sparsely. This means that if you stand at least 2 meters away from somebody, you can significantly reduce the possibility of inhaling droplets. Also, if an infected person wears a mask, that will do a good job of preventing the virus from spraying into the air, and people nearby will be less likely to breathe in the virus through their mouth or nose.
That makes a lot of sense. If you wear a mask, then you won't pass on influenza to anybody right in front of you. And also, everyone around you will be in less danger of catching the disease.
In addition to transmission by droplets, influenza can be transmitted through physical contact. People can get infected indirectly by touching hands, fingers, or objects that have the virus on them. For example, imagine that someone infected with influenza covers their mouth with their hand when they cough. They then touch something, like a strap in a train car, a doorknob, or a telephone receiver, and then
Other people who touch the same thing get the virus on their hands or fingers.
Precisely. Unaware that the influenza virus is on their hands, They might rub their nose and get infected that way, similar to how people get infected through droplet transmission. I'd like to explain how transmission happens this way by using some special effects in a video. A fluorescent substance is used as a substitute for the viruses. When someone touches a doorknob with a hand that has the fluorescent substance on it, the substance sticks to the knob. You can clearly see how other people who touch that doorknob get the substance transferred to their own hand. If the substance were a virus, it might invade their body through their mucous membranes when they rub their nose.
I see. So what do you recommend we do to prevent transmission in this way?
That's really quite easy. All you need to do is wash your hands to wash away the virus. The influenza virus is not able to directly enter the body through the skin. So if you wash your hands, you can easily reduce the risk of infection from physical contact. And also, if you're infected, you should carefully wash your hands to reduce the chances of spreading the virus to others.
So, I can see how important it is to get into the habit of washing our hands.
If an epidemic breaks out, the first thing to do is avoid going out into crowded areas, unless you really have to.
That's because it's likely that someone in a crowd will have the novel influenza virus, right?
Exactly. You can only get infected if you go to a place where the influenza virus exists. Therefore, you could say that the best preventive measure is to avoid the influenza virus by staying at home. If you absolutely must go out and think you might end up in a crowd, make sure to wear a mask. Even if you put on a mask, it's important that you stay in a crowd for as short a time as possible. Also, try to think of ways to avoid places with lots of people and avoid times that people gather. Washing with soap is an effective method of removing any germs, including influenza viruses, on your hands. This is a fundamental way of preventing infection. So let me tell you about the proper way to wash your hands. First, wet your hands with water, apply soap, and lather up. Scrub your palms and then scrub the back of your hands with your palms like this. Make sure you do a good job of scrubbing everywhere, including your nails, in between your fingers, and around your thumbs. Don't forget to also scrub your wrists. Finally, rinse with water and dry your hands by wiping them with a clean towel or cloth. You should aim to take around 30 seconds for hand washing. Please do this after you come home, after coughing or sneezing, after using the toilet, before cooking or eating, and whenever else it would be prudent.
Washing your hands is also an effective way to prevent other infectious diseases, not just novel influenza. It's important to make it a regular habit.
By the way, have you ever heard of the expression cough etiquette?
Is it coughing in such a way that you don't spread any germs to other people?
Yes, that's a good definition. But to be more precise, you should wear a mask if you're coughing and sneezing so that you don't spread germs to other people. If you don't have a mask, cover your mouth and nose with a tissue, handkerchief, or your sleeve, not with your hands, and aim your face away from the direction of other people.
Don't leave tissues used for nasal mucus or phlegm lying around. Throw them away immediately. And if you cover your face when you cough or sneeze, always wash your hands afterwards. This is all part of cough etiquette. If you see someone in your home or workplace coughing and not wearing a mask, you should be sure to tell them to put one on.
It's predicted that a global pandemic of novel influenza would cause significant harm to the health of many people, and that the number of patients suffering from novel influenza would exceed the capacity of medical institutions. Also, healthcare workers might become infected themselves, so that treatment centers could no longer function adequately. Essential services such as transportation and distribution could also be affected, impairing the proper functioning of the whole community.
To minimize the damage caused by novel influenza, national and local governments are manufacturing and actively stocking vaccines, as well as antiviral drugs for the prevention and treatment of influenza. Different countermeasures will be taken depending on the epidemic status. During the early stages of an outbreak, schools might be temporarily closed. If the epidemic spreads, sick people may be asked to stay home.
I see. So, to prepare for an epidemic, arm yourself with accurate facts about novel influenza and make it a habit to wear a mask and wash your hands properly. During an epidemic, there may be times when you have no choice but to stay home, so be prepared. Stock up on 20 to 25 masks per person, as well as food and daily necessities to last at least 2 weeks. And be especially careful if you have to visit a medical institution during a major epidemic. Don't just show up at the hospital. It's crucial that you first consult with your local dedicated consultation center over the phone, and then act calmly based on reliable information. Forewarned is forearmed. Be prepared. Please start today. If all of us are prepared, we can protect ourselves, our families, and our communities from novel influenza.